Then after that, we'll turn our attention to ADHD and learn more about this condition. These are two of the most common behavioral health diagnoses that we see, and we know there can be a lot of misinformation out there about them. So we hope that with the information today, you'll come away with a better understanding of these problems and how to manage them if you or anyone you know are affected by these. So let's start with depression. Depression is now widely considered to be a medical diagnosis. In fact, as I said before, depression is one of the most common problems that we see, particularly in primary care settings. Depression can exist alone in an individual, but it's also often seen in conjunction with a chronic illness, something like diabetes or heart disease or maybe cancer. In fact, depression can co-occur with almost any chronic condition that there is. So as you can see, some of the symptoms of depression include things like sadness, irritability, energy loss, problems concentrating, problems with decision-making, sleep or appetite changes, and even thoughts of death or suicide. Also, in elderly people, pain can be a symptom of depression, so this should be considered in an evaluation for depression in this population. Now, a special note about the last symptom, the thoughts of death or suicide. That is a medical emergency, so if you or someone you know is thinking about this, then this needs to be evaluated immediately in a hospital emergency department. So call 911 or an ambulance if this kind of thing is going on. There are a lot of myths about depression, like it's just deep sadness, or it's some sort of character flaw, or there's nothing you could do about it because if you could, you would have already. These myths can make it really hard for a person who's experiencing true symptoms of depression, makes it hard for them to seek help that's available. As we just said, depression is a medical disease and there are research-supported treatments for it that can help. Sometimes people think that depression happens when something bad happens, like the breakup of a relationship or a death or any other situation that's really difficult to cope with. But the fact is, everyone experiences the ups and downs of life, and people often say things like, "Oh, I'm so depressed." But clinical depression can strike at any time when things are going good as well as when things are going bad. Symptoms of true depression last for prolonged periods of time, not just fleetingly or when you just have a really bad day. People also think that depression will just go away on its own given time. While that may be true for some people, it's usually better to go ahead and seek treatment because untreated, depression can linger for months or even years. And untreated depression can be deadly, as many people may ultimately choose suicide. In fact, one of the sad things about New Mexico is that we rank third in the nation for suicide deaths per capita based on 2008 data, which is the latest year that we have data for. But the good news is, with treatment, depression can actually improve. Let's stop here a moment to talk about a special kind of depression that exists in the diagnosis of bipolar depressive disorder. We used to call this disorder manic depressive disorder. The difference between bipolar depressive disorder and regular depression is that people with bipolar disorder can experience episodes of severe depression as well as episodes of mania. The symptoms for the depressive phase of the disorder are the same as the symptoms for general depression, but the symptoms of mania or hypomania, which is a less severe form of mania, are listed as you see above. And they include things like excessive happiness, grandiosity, recklessness, racing thoughts, and then the other things that you see above. The treatment for bipolar disorder usually involves medication to help regulate and stabilize mood, and sometimes antidepressants are used in conjunction with these medications. There are three commonly recommended treatments for depression. They include antidepressant medications, psychotherapy, or a combination of both medications and therapy. In fact, the research suggests that the best treatment for depression is the combination of medication and therapy. Medications are often prescribed by primary care providers, although they may also be prescribed by psychiatrists or clinical nurse specialists who specialize in psychiatry. Another myth about antidepressants is that they'll change your personality or that you can become addicted to them. But the fact is, even though antidepressants do work by changing your brain chemistry, they're designed to only change certain chemicals that underlie the symptoms of depression, and they can't change your basic personality structure. Most people who take antidepressants are actually very happy to feel like themselves again, rather than feeling so sad and down. And antidepressants are not addictive like some other drugs. That being said, however, if you're taking antidepressants and you want to stop them, please don't do so abruptly. Please talk to your doctor to find out how to safely go off the medication. Some people think that the medications just don't work for them. Let's take a look at some of the reasons why that might be. There are a lot of reasons that medication might not work. One of the most common reasons that it doesn't work is that the person doesn't give it an adequate trial. Now, antidepressants don't work like diabetes or asthma medications. It can take up to 6 weeks to feel the full effect of the medication. Other things that can interfere with the medication not working is not taking it as prescribed, skipping doses, changing doses, or just stopping it altogether. It's very important not to stop the antidepressant cold, just like I said before. Talk to your doctor if you do want to go off to do it safely. Some of the other reasons antidepressants may not work is because there are other medical conditions present that interfere, or the person's also using alcohol or drugs which may contribute to the depression, or maybe even the diagnosis is simply incorrect. Now, another thing about antidepressants is that we know it's very important to stay on an antidepressant for at least 6 months to get the full benefit. People with depression can relapse, that is, experience another episode of the depression. To help prevent a relapse, it's important to recover fully from the episode. Unfortunately, we know that about half the people who experience one episode of depression have another episode at some point in life, and the likelihood of relapse increases the more episodes of depression one experiences. As with other medications to treat chronic illnesses, don't stop taking it just because you're feeling better, or you could lose the benefit of it. You and your doctor, and even your therapist, if you choose to have one, can help you stay on track with your medication. Support for taking medication greatly increases the chance that it will work for you and will help identify early if changes or adjustments need to be made. Let's take a moment to further discuss how to prevent a recurrence or relapse of depression. We call this relapse prevention. As we said, people who experience one episode of depression are at risk for more episodes in the future, but there are some steps to take that help prevent the relapse of depression. We can all benefit from incorporating stress management techniques into our lives, but this becomes particularly important when we're dealing with depression. We'll expand on this a little bit more later. But make sure to do the normal things that help keep a healthy body and mind, like getting regular exercise, eating nutritious foods, and getting adequate rest. Work on developing a positive attitude. Depression can make our thoughts turn negative, which in turn makes us feel worse. Try to combat the tendency to see everything in a negative light and focus on what's going well and what there is to be grateful for. Changing how we think can change the way we feel. Don't neglect other health problems or other prevention activities. Stay on all your medications and make sure other problems you have don't get worse. Take the focus off yourself by doing something for someone else. Volunteering might be something you can do at this time to help you get outside yourself and your own thoughts. And avoid alcohol and drugs. Alcohol is a depressant, and both alcohol and drugs can interfere with your antidepressant medication. Seek the support of others. A support group can be helpful in that you can connect with and relate to other people who've had many of the same experiences as you with depression. Try to reconnect with friends and family and consider getting a therapist. Let's talk a little bit more about how psychotherapy can help with depression. Psychotherapy has been shown to reduce the symptoms of depression. As we said earlier, sometimes psychotherapy alone is used to treat depression. Seeing a therapist can help a person explore problems to develop better coping strategies to manage the depression and the difficult life situations that contribute to it. Therapists can also help a person actually continue taking any antidepressants prescribed by checking in with the person regularly to monitor symptoms and help figure out early if the depression is not responding to medication or getting worse. Talking to someone about problems helps cope with anxiety and stress as well. There are three, or actually not three, but several common types of psychotherapy that are listed above. Just like with medication, a person might need to try more than one kind of therapy to see which one is the most helpful. All of these different types of therapies help to look at what's going on in a person's life that may be contributing to feeling depressed. And again, if one approach doesn't seem to be working, another approach might work better. We've talked a little bit about stress management already when we were talking about relapse prevention. All the techniques to prevent relapse can be considered stress management techniques. Taking care of yourself by exercising, eating properly, getting enough rest, not ignoring other health problems, developing a positive attitude, avoiding alcohol and drugs, and seeking support. Here are some other ideas about how to manage stress on a daily basis. Find ways to practice relaxation. Deep breathing can be done anytime, at work, if you're driving in traffic, during the busy holiday shopping season. Take any opportunity you need to slow down your breathing and get more in control of your reactions and emotions. Or learn a technique like progressive muscle relaxation or meditation. Then that will take the practice of relaxation to a deeper level. Don't forget to do the things that you enjoy, at least one thing every day. Do you like to read or play a musical instrument or play with your pet? Maybe you like to take a hike or go walking in the park or take photographs. Make sure you do something just for you each day. And another thing, managing your money can help you maintain a sense of control of your present and your future. Develop a plan for paying off debt. Try to save something, even if it's just a little bit out of each paycheck. Watching money grow can give you a sense of accomplishment and control. Try to rely less on credit cards and buy only what you need with money you already have. Resist impulse buys and trying to keep up with others. The only thing you might really be keeping up with is their level of debt. Try to set goals for yourself so that you feel like you're getting somewhere. These might be work goals, like getting a promotion the next time around, or maybe it's a personal goal that you have, like to be able to run a 10K or to bike a half-century. And lastly, be realistic about your needs. Do you really need more stuff to be happy? Or will accumulating more stuff just put you deeper into debt, causing more unhappiness and worry? If you think you absolutely must have something, make yourself a promise that you'll get it, but only if it's really as important 3 months from now as it seems today. You might surprise yourself that not only can you live without it for 3 or more months, but you can actually live without it at all. But back to depression. Let's review again the recommended treatments for treating depression. Give the medication a chance to work, talk to your provider about any side effects, and maintain contact with your provider, especially at the start of treatment. Consider using psychotherapy to help you with your depression. Practice stress management techniques to prevent a relapse and to better manage your life, and then read the information we send you if you start a new antidepressant. Anyone with loveless insurance who starts a medication for depression and has not filled a prescription for an antidepressant through us is automatically enrolled in our depression educational series. Now let's turn our attention to another diagnosis that we first notice in childhood, although we now know it can persist into adulthood. This condition is called Attention Deficit Hyperactivity Disorder, or ADHD. Like depression, ADHD is a medical condition that can be treated with medication, therapy, or both. Symptoms of ADHD include problems in 3 areas: symptoms related to having trouble paying attention, trouble with hyperactivity, and trouble with impulse control. Symptoms related to attention can be things like distractibility, difficulty following instructions, difficulty finishing tasks, not listening, or losing things. Symptoms related to hyperactivity can be things like constant fidgeting, difficulty remaining seated, and talking a great deal. symptoms related to self-control include having difficulty waiting for a turn, acting without thinking, and interrupting often. We know that ADHD is present in at least 3 to 5% of children, but the prevalence may actually be higher. We know that boys are more likely than girls to have the diagnosis, and 1 to 4% of adults may have it. But again, these estimates might be low. We're finding more and more out about these kinds of things, about the prevalence. So this might be kind of a low estimate. And another thing, we used to believe that children outgrew ADHD, but we now know that it can persist into adulthood and lead to a lot of problems if not adequately addressed. For a diagnosis to be made in children, they must have symptoms for 6 or more months and to a degree greater than other children of the same age. The symptoms must be present in at least 2 environments, and usually that's home and school. Now, we don't know exactly what causes ADHD, but there are many theories about the cause, which include things about genetics, environmental factors like brain damage from lead in paint, or brain damage for other reasons. There could be sugar or other food additives might cause a problem, or maybe even a combination of all of the above. Researchers are still working to understand the exact causes of ADHD. There's no single test for ADHD. As we said before, symptoms must be present in at least 2 settings, such as home and school. There are a lot of rating scales and screens which observers can use to document behaviors and how often they occur, and that can be useful to help to diagnose ADHD. Parents and teachers are usually given these scales and asked to document the behaviors. They can then provide this information to a pediatrician or a behavioral health specialist who can help interpret the information and give the diagnosis if all the criteria are met. Just like with depression, treatment for ADHD usually consists of medication and psychotherapy. Medications could be stimulants like Ritalin, Adderall, Dexedrine, Methylene, Metadate, or Concerta. There are other medications like Strattera that are non-stimulants. Again, talk to your doctor if you or your child is prescribed any of these medications and you have questions or if side effects are experienced. Family therapy is often very helpful to assist everyone in the family to work together for the benefit of the person with the disorder. When you have a child with ADHD, you know there are many challenges in day-to-day life. Try to keep in mind these tips to make life easier. Encourage and reward good behavior when it happens. Try to look for positive actions when they occur, even if they're actions that most other people just take for granted. Try to discourage any inappropriate behavior on a consistent basis. In fact, consistency in all things is very important. Make sure you and others who interact with the child are all on the same page. This helps to reinforce the behaviors that you want to see. Try to remember that the child is not the behavior. You may love the child but dislike the behavior. Try to build self-esteem by showing that love. Allow the child to take frequent breaks from tasks. Like all children, children with ADHD need regular play and exercise. Try to keep it simple. Have a daily routine that the child can expect and count on. And another thing is limit choices. Ask, do you want this or that, instead of asking, well, what do you want? Work with your child's school. Plan a consistent approach to behavior and homework. And don't forget to take care of yourself as well. When you take the time for self-care, you will have more energy and more to give for others. Remember those stress management techniques we just discussed for depression? Well, they can help with managing ADHD as well. The same rules apply. Get plenty of exercise, eat nutritious food, get regular sleep, take care of your emotional health, and consider attending a support group. And practice the above-mentioned stress management techniques. All these things can help you manage your own physical and mental needs. We've covered a lot today about 2 common behavioral health diagnoses. Well, what's next? We encourage you to learn all you can about these disorders, or if you or someone you know are affected by them. There's a lot of great information out there on these kinds of problems. On the Loveless website, we have a link to great resource information. We have a website that's called Health Education Answers, and that's an external website, but it has a lot of behavioral health information, especially about depression and ADHD, as well as other health education topics. And again, more information out there. Loveless wants to make sure that members are knowledgeable about all kinds of things, preventive screenings, recommendations for specific chronic illnesses, and just general prevention activities. So information on this and the next slide is for both preventing health conditions and managing chronic conditions. So please take a moment just to read the information on the screen. We encourage you to talk to your doctor about the preventive screenings, as many of them are not a one-size-fits-all. The tests for chronic conditions listed are part of standard care, but it's always a good idea to discuss this with your doctor as well. We'll stop for just a second and let you review this slide. Okay, this slide continues with more chronic conditions and recommendations if you have these diagnoses. The right-hand column lists other prevention activities we suggest our members participate in to get and stay healthy. So again, take a moment to review this slide, and if you have any questions about this, email us at healthysteps@loveless.com. Here are some complimentary resources offered to Loveless Health Plan members. We offer telephone counseling for weight management, online health tools, including a health risk assessment, consumer health tools, health education, wellness discounts through our Choose Healthy program, and our monthly webinars about health topics. So visit our website at lovelesshealthplan.com, click on the online member options, and follow the login instructions to access these resources. Well, thank you for joining us today for this webinar. Again, please direct any questions or comments that you have to the above listed website and complete the evaluation you'll receive, and check our website regularly for more webinars on topics to improve your health. We hope that this has been helpful to you today, and thanks again for joining us, and now we'll say goodbye.